Over 110 million people in the US have either prediabetes or diabetes, so it's essential to know these topics for the USMLE, ABIM, ABFM, PANCE, and given the prevalence in the young population, the American Board of Pediatrics Exams. There are 4 ways of diagnosing prediabetes and diabetes. We can look at either the fasting blood glucose, a 2-hour postprandial glucose, a hemoglobin A1C, or a random blood glucose. Here are the important cutoffs to remember when making the diagnosis of prediabetes and diabetes. If we're using the fasting glucose, we want to remember the numbers 100 and 126. A fasting blood sugar up to 100 is considered normal. 100 to 125 is considered prediabetes. 126 and above is suggestive of diabetes. For the 2-hour postprandial glucose, the important numbers to remember are 140 and 200. A 2-hour postprandial glucose up to 140 is considered normal. 140 to 199 is considered prediabetes. 200 and above suggests diabetes. And for a random blood glucose, we need to remember just one number, 200. 200 and above is suggestive of diabetes. Up to 200 is indeterminate. For the hemoglobin A1C, which again is a 3-month average of the blood sugar, we want to remember the numbers 5.7 and 6.5. It's normal to have an A1C up to 5.6. 5.7 to 6.4 is considered prediabetes, and 6.5 and above is suggestive of diabetes. Now, to actually make the diagnosis of diabetes, we need to have the following. We could have 2 of the 4 techniques done simultaneously, or the same technique done twice on different occasions. Lastly, if we have a random blood sugar greater than 200 in the setting of either polyuria, polydipsia, or unintentional weight loss, we do not need to repeat. That is adequate to make the diagnosis of diabetes.